Hiya, I'm Leslie, I'm 56, I've got COPD, emphysema, and I was diagnosed when I was about 50 properly, and since then it's gone really downhill. I was silly, I didn't give up smoking until it was too late. And my day-to-day life has changed completely. I found that coming to the hospice and the breathing exercises, they really do help. I didn't think they would, but they do, and they give you confidence and learn you how, when you're going into a panic, to like talk yourself out of it, settle yourself down. And it's been really, really helpful. And they give you confidence as well, because where you think everybody's looking at you, when you're out, it's not very nice sitting in your wheelchair. So yeah, it's not every exercise helps everyone, but you'll always find something that helps you. I wear my oxygen all the time now, just even going to the toilet and back. Before, I just used to use it now and again, but as it's progressed and got worse, I have to use it all the time now. The only time I don't have it is when I'm asleep at night, unless I got a chest infection, which I get once a month. And then I wake up and I can't breathe properly and the oxygen has to go straight back on. But without it, I wouldn't be able to do anything, so I have to use it. When I wake up in the night and I can't breathe, it's usually because I'm getting a chest infection, and I know then I have to start taking my steroids, antibiotics, and use my pumps more and the oxygen more through the night. And then it's all like counteracts, because where you're on the steroids, you can't sleep at night. So you're waking up and the oxygen's near enough on all day and all night. Well, the worst thing that I've had to pack up, and I know it sounds really silly, is dancing. I used to love to dance. I wasn't very good, but I was always the first one on the dance floor. And of course now grandchildren, I can't run around with them. Quite upsetting, but they're so used to seeing me with me oxygen. I mean, they try and pull it off and kill me, but I don't think they actually mean it. But it's things like that I miss, really miss. If I'm going out, I have to have all my clothes ready the day before so that I don't panic about what I'm wearing. I have to have a bath and wash my hair in stages, can't do both together anymore. And when you wake up, sometimes you think, you forget. And then as soon as you step out of bed, you can't breathe, and it's like, ooh. But apart from all that, I am quite a happy person. I'm not like sad all the time. Sometimes my breathlessness is worse in the winter because of the damp air. And so I tend to stay in a lot in the winter. I love the summer because you can sit out more, but then getting too hot sometimes brings it on as well. So you have to take it as it goes, really. Panic is the worst thing, because sometimes I've called an ambulance out once and I was having a panic attack. I felt so silly. But when you can't breathe, it's exactly the same, and you just feel like you're going to die. It's the scariest thing I've ever felt.
My name's Norma Miller. My diagnosis is severe chronic brittle asthma with mild heart failure on the right side. My breathlessness affects my everyday life by stopping me from doing what I want to do, and I just can't do everything I should do, and I get really frustrated with it. Going to post a letter, I can't do that on my own now. I've got to get my husband to take me in the car to get me to the letterbox, which is just down the road. Getting up and doing just general things, like today it took me an hour and a half to get dressed this morning to come here. If I'd had a shower before I done that, it would have took me 3 hours to do it. It's just that I'm just getting so breathless. Doing the simple things like getting dressed in the morning. The things I do to help me cope with the day is I pace myself. I just do little bits, and then I have to sit down, rest, and then I can do a little bit more. Sometimes I go at it like a bull in a china shop and then suffer, but that's a silly way to do it. I've learned that just do a little bit and then stop, catch my breath, maybe have a cup of tea, and then carry on doing what I was doing before. So I sort of give myself about 1/4 of an hour maximum of doing the task, and then about a 3/4 of an hour rest to be able to do what I want to do. What people think about my breathlessness is because it's a hidden disability, they think, oh well, she's just puffing and panting just for the hell of it. I don't think they realise how bad it is, until one day I had a full-blown asthma attack at the Moose Hall because we belong to Moose, and they didn't believe me. And then when I had the asthma attack, they all got such a shock to see how poorly I was. It made them sit up and think, well, no, she isn't putting it on. It is for real. And I think a lot of people look at you as though, oh well, because you're overweight, that's why you're out of breath. And it isn't. Well, when I'm having an asthma attack, it is very scary because I can breathe in, but I can't breathe out. It's as though I can breathe in through my nose, but my throat closes and I can't breathe out through my mouth. And it just feels as though my lungs are going to fill up and I'm going to explode. And it is very, very difficult. And my husband says it's very frightening to watch. And he feels helpless because there's nothing he can do to help me. Well, the things I've learned from the hospice is, one, the pacing, to take your time to doing things, not to rush it. The exercises helped me. I found that I was a lot more mobile with the exercising, and the breathlessness course actually made me stop and think and say, well, yes, my condition is worse than what I ever thought myself. I actually started to accept my condition, because before I came here, I was in denial with it. Coming on the course and coming to the hospice, I'm actually meeting people with the same sort of symptoms, and we can learn to cope together. I'm not on my own. There are other people the same as me, which is a big help, because when you're an asthmatic, you feel isolated because no one else round about you has got the same problems. And it's nice to be in a place that, yeah, people are breathless, people do have the same problems, and you can learn from one another how to cope with things. The breathing techniques that I've learned here is that you breathe in your nose and out through your mouth, and if you're having problems emptying your lungs, you purse your lips and just keep breathing until you can't breathe out anymore, and then you get a better quality of breath in and a better quantity of breath in once you've emptied your lungs. Instead of shallow breathing, you're doing deep breathing. You're using the diaphragm rather than just the top of your lungs, and it's really helped. And if you've got a productive cough, there's a huffing and puffing technique that helps loosen what's laying in your chest so you can get rid of it, and that makes life a bit easier for breathing.
Yeah, my name's Brian, and my illness is COPD. which I've had for maybe, I think, 2 or 3 years, and it's not very good. I don't like it. Well, my hobby was fishing, and that's right out of the game now. I can't do anything like that. Even if I'm taken to the lakes, that's, I can't do any more than that, and just sit and watch. And it's at home. I can't do any at home. No gardening, no nothing like that. No cutting grass. I used to like doing that. We've had to downsize in our house because we lived in a house that we bought to retire in, and then I became ill, and then we had to move to a bungalow. I had to buy a bungalow, which in our time of life was a little bit, the money we had, we didn't really want to use it on that. We want to use it on other things, but the owners didn't allow that. So, but where we are now is really good. It's all on one level, and I can do what I want. Well, I'm on my way ahead, but people keep saying, "Oh, you'll be fine, you'll be fine." And when they say that, then I just I can really get annoyed, because they don't. I don't think they know, or they don't want to know, or they think, "Oh, I'm going to get better," but I ain't going to get no better because they're in a white Charger come through the back door, That ain't going to happen, And I've been to other things. Since I've been coming to hospice, I've had treatment from a lady named Anna and her partner, that's psychiatrist, and trying to see if they can get rid of my anger and stuff. And it worked. I've been twice now. 2 times, 9-week time. Yeah. I'm a right pain to live with. I really am, Especially between, we've had a real bad time, me and Valerie. That's my wife. And okay, at some stages it got really difficult between me and her, when she was on the stage of packing her bags, and but she's still here after 40 odd years, so must be something. No, it's really and I didn't have a lot of patience at all. I still haven't got a lot now. I can be quite abrupt with people. People say to me, "Oh, you're looking well," But my answer is, I may look well, but I don't. You want to be inside my body, and then you'll know how I feel. And because as the doctors have always said to me, that you look really well. It's quite embarrassing. You're sitting in front of me, and you got a suntan, and you got all this, And but yeah, life on a whole with people and family been very difficult. Yeah, some of the things that helped me are, especially the hospice. They helped me a lot. I couldn't paint I never painted at school or nothing like that, and I only been painting now for about 12 months, and I'm turning out quite some nice work, and I've sold quite a few paintings and stuff like that. And I really miss that one day a week, when the new system, but now I'm back to the hospice for 8 weeks, and that is a big help, because otherwise I'm just stuck indoors, and it's hard, and sometimes you feel really good, but you got it on your mind all the time, being ill, and I like to know what's going down. I ask the doctors and the surgeons what's going to help me, and what have I got to look forward to? And they laugh and say not a lot, but no, they don't say that at all. But I like to know the truth, you know, and sometimes I think, oh, I don't know if I really wanted to know that, but yeah, but I think it's better that I know, and better that when Valerie, like, you know, and we talked, I don't know if that's applicable, but we've talked about end of life and stuff like that, you know. Do I want to stay in the hospice or go to the hospital? I want to stay here, you know. And yeah, so Valerie knows what I want. Everything's in order, you know, with the right people. I know that sounds a bit morbid, but yeah. I get to my, no, what helps me was with my breathing and that is not when I'm trying to slow down, but I just got to get to somewhere, like, you know. And the slower I seem to get, I keep stopping, and then just from the lounge to the bathroom, that is really hard work. And the same when I come back, it takes me a few minutes to get my breathing back to some kind of normality, you know. And yeah, and I don't know. I just never thought it'd be me, you know, which I don't think you do, you know. I mean, a few years ago, when I retired early, and I thought that's going to be great, like, you know, but it wasn't, you know. I retired 5 years early, and then as soon as I retired, a few months afterwards, that was it, you know. It started, and then it was very quick, you know. I went from being quite well to being rubbish, like, you know. But I think about it all the time, you know, as soon as you wake up, when you go to bed, you know, when the weather's bad, you know, and stuff like that. But I started having panic attacks for some time now, and that is not very good. That is so scary. But we've had breathing exercises at the hospice, and that really helps. But when it starts to come, sometimes you forget all about what you've been told to do, you know. And Valerie keeps telling me to slow down, you know, rest, breathe properly, and, you know, do this, do that. And but anyway, you know, it's as I say, they give me this Ormol would call it, before I go to bed, and then this tablet under my tongue, and that helps. But when I do first get into bed, the pain is really bad, and it used to take me an awful long time before I was on taking this stuff at night time, before I went to bed. But now it's only a few minutes, you know, 3 or 4 minutes, but before it could be 10 minutes, you know, when you think you're going to kick the bucket, you know. And yeah, that's scary, and that's still a big worry for me, you know. And because I know come bedtime, then that's gonna start again. But when I've settled down, you know, like I am now, I don't seem, you know, I feel all right, and quite relaxed, you know. But it's very easy to get stressed out, you know. If you want something, you want it done yesterday, you know. And say somebody go to town for you to get your things, and they come back and forgot it, you know. I don't let them forget it, you know.